Topic name is Neurobiology of substance use. It can be a long question in your PG and post-graduation examination. Okay, you can be asked individually about alcohol, opium, tobacco. They don't ask too much about cannabis and hallucinogens. And we shall be discussing some part of the individual today, and the remaining some part we shall be discussing with the individual topics. For example, the next two lectures are based on alcohol. Then I have planned tobacco, cannabis, opium, one lecture each, then others, etc., etc. So when we will be discussing individually, we shall discuss again. Some of you students have been a part of my module 2 as well, and I always tell how to write the questions of neurobiology. The neurobiology question always starts with neuroanatomy, that is the brain areas involved. Neurophysiology, anybody remembers how do I teach neurobiology? I have taught this to you in module 1 child psychiatry as per ADHD. In module 2 in adult psychiatry I said schizophrenia. So how did I teach you neurobiology? Neuroanatomy, neurophysiology, then what else? What are the headings? I know the headings, but I am waiting for you to answer. Neuropathology and neuroradiology. Since we are talking about a condition, biology of substance use, there is not much role of radiology and pathology here. So we shall be talking about only two areas, that is neuroanatomy and neurophysiology. Look, I always teach in a way like how you are supposed to write the paper in the exam. Some of you residents are third year resident who have recently written final MD exams, and I have got the feedbacks from your group only that we have written the exam question just like the way you made us write. So what are the brain areas implicated? What are the neurochemicals or neurotransmitters? If you start writing like this, the examiner would be a little more impressed by the clarity of thoughts in your mind. That means you have a clear idea of the brain areas involved. The most important brain area involved is reward pathway. The reward pathway is also known as mesolimbic dopaminergic pathway. It starts from ventral tegmental area of the midbrain and goes to the nucleus accumbens. Mesolimbic. This is just the introduction of this chapter. It starts from the ventral tegmental area of the midbrain and goes to the nucleus accumbens. Parallelly, we will talk about the most important neurotransmitter involved in substance use is dopamine. Most important. Others are enkephalins, endorphins, serotonin, acetylcholine, glutamate. Everything has a role. We will be discussing this in depth. Now in neuroanatomy, the second most important area is CSTC loop, cortico striato thalamo cortical loop, in which the parts of the cortex involved are orbitofrontal cortex, anterior cingulate cortex, dorsolateral prefrontal cortex, ventromedial prefrontal cortex, thalamus, striatum, dorsal striatum, ventral striatum. Once you write this, examiner would know that you know what is to be written in this chapter. So this is the broad heading of this chapter, and we should be able to explain each and every part and its role. Suppose I ask you, what is the role of glutamate in addiction? Suppose I ask you, what is the role of endorphin in addiction? What is the role of serotonin in addiction? What is the role of orbitofrontal cortex in addiction? What is the role of anterior cingulate cortex in addiction? So there are almost 7-8 anatomical areas, almost 5-6 neurotransmitter. If you line one line or two line about each, you will be able to fill up 3 to 4 pages. I'm not teaching you how to fill up pages because this is not an undergraduate exam, this is post-graduation exam. But like I always say, in any postgraduate MD exam, the long question is 20 marks and the time allotted for a long question is maximum half an hour to 45 minutes. Okay, because you have to complete it in half an hour and 45 minutes. So in a half an hour and 45 minutes, maximum you can write 5, 6 or 8 pages. If you are very fast, 10 pages. So you should be able to make the topic consolidated in 5 to 10 pages. That's all. This is the maximum time we have for writing a long question. Usual paper pattern is 20 marks long question, 10 marks short question. So if you get 2 long questions of 20 marks, I tell you to devote 1.5 hours to long question and 1.5 hours to short questions. So that 40 minutes approximately for a long question and 10 to 15 minutes for a short question. You know, sometimes what we do is we read more than what is required for a long question. I want to be crisp, concise, to the point, and this is what you are supposed to tell in Viva also, the brain areas involved. It looks very simple to make a list, but it's not as simple as it looks like. So I am going to take you to a journey of biology of substance use. Are we ready? You will start like this. So there are anatomical brain parts, there are neurochemicals involved. Most important brain part, please make sure that reward pathway and dopamine comes as the first, because others are relatively less important. Others are relatively less important in comparison to the first. So your first points on both sides should be reward pathway, dopamine. Please write it properly, neat and clean, everything. Are you understanding how to write this paper? Okay, just before I take you to a formal notes making and understanding all these pathways and brain areas, let me tell you the psychological concepts of addiction, correlation with the biological. What is the reason a person takes a substance for the first time? What is the reason a person takes the substance for a first time? Shall I give you options? Recall the first drink of alcohol you have taken, if at all you have taken. Nothing to hesitate, okay? No need to lie as a psychiatrist in front of a psychiatrist. Recall the first drink. एक बार याद करो कि आपने अपनी जिंदगी का पहला अल्कोहल का ड्रिंक कब लिया था और क्यों लिया था. बहुत पुरानी बात पूछ रहा हूं मैं. कई साल हो गए आप में से कुछ लोगों को पहला ड्रिंक लिए, क्योंकि अब इतने बड़े हो गए हैं कि पहला ड्रिंक लिए हुए कई साल हो गए. Now you have so much of grown up that you have forgotten. The first drink is due to, let me ask you the options. The options are amusement, excited about alcohol. Let us see what it is. Curiosity. क्या है इसमें जिसके लिए दुनिया पागल है, हम भी तो देखें क्या है इसमें. Let us see, like Anupama said, curiosity, amusement. Number 2, to get a high, to celebrate, to party. अभी तो पार्टी शुरू हुई है. You went to the party and all the friends were drinking and dancing. You also wanted to dance. So to clear your inhibitions, to party, to suppress your frontal lobe from stopping you to express. So in the party. Okay. Number 3rd reason. First reason is amusement. Second reason is to enjoy the party. Third reason is after a sadness, breakup. वो रात अपन 2 बजे तक पिया, मुन्ना भाई MBBS. ओके. ब्रेकअप, आज तो पिएगा. फाइट विद अ फ्रेंड, आज तो पिएगा. टुडे आई विल ड्रिंक. I am bilingual in this topic because Hindi adds spices to this topic. Although my teaching is purely English, so that students from other part who don't know the Hindi language can understand better. But in this topic, I will be bilingual. I am 100% bilingual. I can speak both the languages proficiently. So in this topic, I'll be bilingual because Hindi will add some spices to this topic. Third is to end sadness. And fourth and last but not the least reason is peer pressure. In a boys' hostel, some boys telling other boys, पी के बता, है हिम्मत, मर्द का बच्चा है तो पी के बता. Out of the 4 reasons, what do you think is the most common reason of a first drink in a youngster? Option 1, amusement, curiosity, give it a try. Option 2, to enjoy, party. Option 3, to take care of your grief and sorrow. And option 4, peer pressure. Can you guess? सबसे पहला ड्रिंक लेने का मोस्ट कॉमन कारण क्या है? ट्राई करके देखते कैसा लगता है. दूसरा, पार्टी करने के लिए, खुशी पाने के लिए. तीसरा, गम भुलाने के लिए, अमनीजिया. कुछ लोग कहते हैं इसको पी के तो मेरा गम जाएगा. और चौथा, फोर्थ, दोस्तों के प्रेशर में आके. What is the most common reason of a first drink? Krishnendu Datta, your answer is correct in terms of biology. I was asking in terms of psychology. Come on. What is the most common drink, a reason of the first drink? Guess करोगे? Why I am telling you this? Because the loop of addiction says that we start a substance for the positive effects. The positive effects are either disinhibition, that leads to pleasure, or amnesia, that leads to pleasure, or enjoyment full, that leads to pleasure. Okay, so we start the substance to take pleasure. Now what happens? A person tried the first drink. The first drink gave him pleasure. Okay, this first drink pleasure forms a memory in him. Always there are some people who remember that when I first tried alcohol, I felt so great. I want to try it once again for the experience. Then you try second drink, same pleasure. You try third drink, same pleasure. You try fourth, fifth, nth drink, let's say. After some time the pleasure reduces. This is not from any book, this is my own concepts. What is this phenomenon known as? After some drinks the pleasure reduces. What is this phenomenon known as? The question answer is, the first drink reason is different in different individuals. For boys it is more commonly a peer pressure, and for girls it is more common of curiosity. Although it is not a hard and fast rule. Come on. Tolerance. Very good, Sundaramurthy. So technically every substance develops tolerance. Okay. So now one drink previously was giving X pleasure, now it will give less than X pleasure. Now you have two choices, either to stop it because it is not giving pleasure, or try two drinks. So if you try two drinks, again you get X pleasure. So now 2. After some time 2 will also be less than X. Again tolerance. Again two choices, either stop the two drinks or make it 3. Now 3 pegs. So 3 will give X. After 5 times 3 will also be less than X. Are you understanding the addiction cycle? मैं हिंदी में एक्सप्लेन करता हूँ. पहले एक ड्रिंक लिया, मजा आया, फिर कुछ दिन नहीं लिया, अब मन किया एक और बार वही ड्रिंक लेके मजा लेते हैं. आ गया फर्स्ट ड्रिंक मजा, सेकंड ड्रिंक, फर्स्ट ड्रिंक एक सिंगल पेग, मजा 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 मजा. 10 बार सिंगल पेग लेने के बाद सिंगल पेग से मजा बंद, नोन एज टॉलरेंस. अब दो चॉइस, या तो सिंगल को बंद कर दें या डबल चालू करें, 2 पेग चालू करें. तो 2 पेग पे मजा आ गया, फिर 2 पेग बंद, फिर 3 पेग पे मजा आ गया, फिर 3 पेग बंद. Then quarter, 3 peg is almost as good as a quarter. Then half, then full, है ना. 3 पेग के बाद क्या है? क्वार्टर, आधा, खंबा, 2 खंबे. Can you guess how much maximum alcohol a person can drink in a day? I found a man in Assam when I was doing MD psychiatry. He was drinking 3 to 4 liters per day. I don't even drink 4 liters of water in a day. The moment he got up in the morning, he washed his face with alcohol, brushed with alcohol, okay, then properly drenched in alcohol. So opens the eye with alcohol, cage, eye opener. Then before breakfast alcohol, after breakfast alcohol, midday meal alcohol, pre-lunch alcohol, post-lunch alcohol, evening snacks alcohol, pre-evening snack alcohol, post-evening snack alcohol, pre-dinner alcohol, post-dinner alcohol. And these type of people have alcohol dependence. Not only alcohol dependence, they also have alcohol related liver disease to the extent of cirrhosis, to the extent of portal hypertension, and to the extent of alcohol withdrawal within a few hours. The patient's wife told me, sir, when my husband doesn't drink, he gets shakiness. I thought she's talking about tremors, that is mild withdrawal. She was talking about seizure. Sir, when my husband doesn't drink, he gets seizure within 3 hours. Then I say, okay, what do you do when he gets seizure? Sir, when he is getting seizure, I put alcohol in his mouth and then seizure subside. Excellent. Alcohol is the beautiful anti-epileptic for alcohol withdrawal seizure. So I have seen people to the level of alcohol dependence, to this level that they get withdrawal symptom within 3 hours, withdrawal seizures within 3 to 4 hours, 6 hours. They don't even need 24 hours to develop alcohol withdrawal seizure. And I don't know whether you know him or not. My professor and head was Dr. Dipesh Bhagwati. He's now HOD in Agartala Medical College. He presented a case to us. He presented a case report, alcohol dependence, youngest patient in Assam. His age was 9.5 to 10 years old. Alcohol dependence, 9.5 to 10 years. It's not tolerance, it is dependence. So you try to understand, dependence takes time to develop. So gradually what happens is, you don't get a kick on that particular level. So you try to increase the dose, increase the dose, increase the dose. But what happens, eventually after a time, you stop getting the positive effects due to the substance. Now you have to continue the substance so as not to have the negative effects. So as not to have the negative effect. Try to understand. Are you understanding the mechanism? Mechanism is first drug taken to get positive effects, then more taken because positive effects were not coming on the same quantity, more taken. After some time the positive effects stop coming. Now the person tries to stop the drug. When he tries to stop the drug, he gets withdrawal. So he's not able to stop the drug. Now he's taking not to get the negative effects called as withdrawal. Do you understand the phenomenology of dependence? The phenomenology of dependence is try, pleasure, increase the amount, tolerance, tolerance, dependence, dependence, can't quit due to withdrawal symptoms. So he started to get pleasure, but he can't stop because he gets withdrawal. ऐसे होता है dependence. Do you understand the phenomenology of dependence? This is my own conceptualization, oversimplified conceptualization. Do you understand this? This is the way you conceptualize dependence. This is the way you explain dependence to the patients. This is the way how I handle my drug dependent patients. Do you understand? एक डायलॉग है एक मूवी में, शुरू मजबूरी में किए थे, बाद में मजा आने लगा. बट यहाँ पे उल्टी कहानी है, शुरू मजे के लिए किए थे, बाद में तो मजबूरी बन गई. क्या ये समझ में आया? इट इज अ वेरी बेसिक कॉन्सेप्ट ऑफ डिपेंडेंस. फ्रॉम हियर आई विल टेक यू टू द बायोलॉजी. Krishnendu, this is what you were talking about. Impulsivity. And this is what I am talking about. Compulsivity. The latest concept of biology of addiction is impulsivity compulsivity circuit. If you write this circuit, the examiner would know that you have read the latest stall, because in the previous stall this circuit was not there. In the latest stall this circuit was there. So the most important concept of biology of dependence is impulsivity compulsivity circuit. So from here I take you to the biology. Now tell me, are you understanding? Do you see how did I made up the framework? मैंने कैसे भूमिका बांधकर आपको phenomenology से biology की तरफ push किया है? Do you understand this? I had to plan this, how to explain this concept to you. So did you like? Did you understand? Because now we will go to the hardcore biology. What is impulsivity? Inability to stop. इनिशिएशन ऑफ एक्शंस, खुद को कोई काम शुरू करने से ना रोक पाना. What is compulsivity? Inability to terminate ongoing actions. If somebody asks you what is the reference of these definitions, the reference is Stephen Stahl. I prefer to teach from the textbook rather than from the articles because a postgraduate resident should be able to quote the textbooks. What is the impulsivity circuit? Today you have to draw a lot of things. So I would appreciate if you people have colored pens. This is impulsivity circuit. It starts from anterior cingulate cortex, goes to the ventral striatum, goes to the thalamus, back to the cortex. Technically this is CSTC loop, cortico, striato, thalamo, cortical, ACC, VMPFC. This is your impulsivity circuit. Yes, Sundaramurthy, this is the last chapter from Stahl. Whenever a question comes on neurobiology, the first book I refer is always Stahl. Look, rather than drawing absolute diagrams, I would prefer to draw line diagrams. Impulsivity. Now what is the compulsivity circuit? Orbitofrontal cortex to dorsal striatum to thalamus back to the orbitofrontal cortex. This is the compulsivity circuit. Now, there is a part of the brain, dorsolateral prefrontal cortex, to dorsal striatum, to thalamus, to here. This brain part has a role in cognition. I will explain this to you. And this gives stimulus to both impulsivity and compulsivity circuits. Now this impulsivity and compulsivity circuits also get stimulus from amygdala, and hippocampus. The role of amygdala is reward conditioning, and the role of hippocampus is memory. Now if you draw this looks very impressive, a little complicated. Actually, I wanted to squeeze it in one chart, that's why I was adjusting. Are you able to copy? I'll make you understand this. Impulsivity, compulsivity circuit. Let me know after you have copied. Obviously this is from stall, trying to little simplify this. Yes, I am going to explain this. Now, see the first upper half of the screen. See this. This is impulsivity circuit. The brain gets a stimulus, taking a substance. What is an impulse? Inability to stop yourself from initiating its action. You got angry on your friend, you hit him. What is the brain part that makes you hit? This impulsivity circuit. What is impulsivity? Man kiya kar diya, man kiya kha liya, man kiya daru pi liya. This is impulsivity. The stimulus comes from CSTC loop number 1, anterior cingulate cortex, ventral striatum, thalamus. This. Now this stimulus, this ventral striatum also get stimulus from DLPFC. You can see it is a top control over the ventral striatum, top control over the impulsivity circuit. Cognition. What is DLPFC? DLPFC is dorsolateral prefrontal cortex. The two main functions of dorsolateral prefrontal cortex are executive functions and working memory. What do you mean by executive function? Planning, organizing, sequencing, abstracting, cognitive functions. I talked to you about this in schizophrenia, that cognitive deficit is due to DLPFC involvement, and DLPFC helps in planning and execution of an event. So DLPFC, this part has a role in impulsivity and compulsivity. It is an independent circuit that gives stimulus to both ventral striatum and dorsal striatum. Now, another part is amygdala. Amygdala gives reward conditioning. Okay, reward conditioning. The impulsivity circuit gets a reward conditioning from amygdala. Amygdala is the center for emotional memories, the emotional stimulus, the cues, the emotional cues that are related to amygdala, and hippocampus gives the stimulus in the form of memory. It's not that the amygdala is only on the impulsivity, not on the compulsivity. It is on the both. So this is our impulsivity circuit, and this is where the person starts the substance from seeking a high, that is impulsivity, to relief from withdrawal, that is compulsivity. Compulsivity means inability to terminate the ongoing action. First drink, impulsivity. Impulsivity is what? Pleasure seeking. High. Gradually you get tolerance, and impulsivity converts into compulsivity. Seeking relief from withdrawal symptoms. The same thing that I explained in the form of phenomenology, the circuit shifts from ventral striatum circuit to dorsal striatum circuit. If you can explain this, that means you can explain dependence. If you can explain this, that means you can explain dependence. Brain circuits are not that easy to understand, but Stahl has very well given these circuits, very simplified. These topics are not well given in Kaplan, Tasman, Oxford as much as good given in Stall. Come on, did you understand this? एक बार हिंदी में बताऊं, पहली बार क्यों लिया इम्पल्सिविटी, मजा आने के लिए, कहां से चला, और एंटीरियर सिंगुलेट कॉर्टेक्स, वेंट्रोमीडियल प्रीफ्रंटल कॉर्टेक्स, वहां से स्ट्राइटम, स्ट्राइटम से थैलेमस, थैलेमस से कॉर्टेक्स, उसको स्टिमुलस मिला प्रीफ्रंटल कॉर्टेक्स से, ठीक है, डॉर्सोलेटरल प्रीफ्रंटल कॉर्टेक्स से कॉग्निशन, प्लानिंग, ऑर्गेनाइजिंग, एग्जीक्यूटिव फंक्शन, उधर से आया अमीगडाला से रिवॉर्ड कंडीशनिंग, हिपोकैम्पस से आया सब्सटेंस की मेमोरी, जो पिछली बार पी के अच्छा लगा था वो मेमोरी फिर से आई, फिर प्लेजर सीकिंग से वो डॉर्सल वेंट्रल स्ट्राइटम से डॉर्सल स्ट्राइटम पे शिफ्ट हो गया, डॉर्सल स्ट्राइटम वाले सर्किट का नाम क्या है, और बाइटोफ्रंटल कॉर्टेक्स, वो इंपल्सिविटी से बन गया कंपल्सिविटी, और बाइटोफ्रंटल कॉर्टेक्स, स्ट्राइटम, थैलेमस और बाइटोफ्रंटल कॉर्टेक्स. Did you understand this? If you can write this in your exam, the biology of substance use chapter is half over. अगर आप ये लिख पाए जो मैंने अभी लिखा है, then your chapter is half over. In this chapter we will draw a lot of circuits and make a lot of diagrams. Do you understand this? Sundaramurthy, one more time for you. The impulsivity circuit is this: anterior cingulate, ventral striatum, thalamus, this. I took the substance once. Enjoy. Tolerance. I move to compulsivity circuit. Cognition. The dorsolateral prefrontal cortex has a control over both the circuit, impulsivity circuit and compulsivity circuit. You understand this? Come on, respond. Are you still writing? Are you understanding this? How impulsivity converts to compulsivity? If you can explain this, your teacher would be very happy. Any doubts, any question, any comments about this circuit? Do you understand the role of DLPFC? Do you understand the role of amygdala? Do you understand this? Yes, come on, can I go to the next topic? Okay, so this is the brain anatomy, the brain areas involved. The most important pathway is reward pathway. Ventral tegmental area, nucleus accumbens. We have already spoken about why there is a shift because of tolerance. वही वाली बात कृष्णेंदु, पहले तो मजे के लिए शुरू किए थे, बाद में मजबूरी बन गया. This is the mesolimbic pathway. Mesolimbic pathway, dopaminergic fibers. Do you know all the dopamine pathways? I think in the second module, when I was speaking to you about schizophrenia, I spoke about dopaminergic pathways. All of you remember the 4 dopaminergic pathways: mesolimbic, mesocortical, nigrostriatal, tubuloinfundibular. I shared the photographs of these also because many of you students are connected to both the modules. Am I having new students in module 3 who were not a part of module 2? Shall I repeat dopamine pathways? Sandhya, DLPFC. Do you know what is the role of DLPFC? Dorsolateral prefrontal cortex. It is the most important pathway in cognitive functions, attention, executive functions, then working memory. It gives a control over both the impulsivity and the compulsivity circuits. Shall I again tell the dopamine pathways? Shall I again show it to you? New students in module 3. I'm asking you, are you people aware about the dopaminergic pathways? Where from where? What are the roles? Very good, Rachit Sikchi. Mesocortical, tubuloinfundibular, mesolimbic and nigrostriatal. Clear about this? Sandhya, your doubt is answered. Increase of dopamine in this pathway is thus central to the reward. All substances ultimately act on reward pathway, either directly or indirectly. Thalamocortical does not have too much of clinical significance. Okay, have a look once. Dopaminergic pathway. This is your substantia nigra. Okay, from here a pathway goes to the striatum. This is your nigrostriatal pathway. Visible? Nigrostriatal. Now this is your ventral tegmental area, midbrain. From here goes to nucleus accumbens. Which pathway? Mesolimbic pathway. From here goes to cortex. Which pathway? Mesocortical pathway. And which one is this pathway? From tubuloinfundibular. It is not that much visible. It is better visible here. This is your tubuloinfundibular, hypothalamus to pituitary. This is your mesocortical to DLPFC and to VMPFC. This is your mesolimbic. This one is your nigrostriate. Are we aware about these? Okay. Now a few theory points. All substance increase dopaminergic acid via this pathway. Second theory point which we'll write here is the reinforcing effects of the drug are largely determined not only by the presence of dopamine. Just presence of dopamine is not enough, increase, but also by the rate at which it increases dopamine in the brain, which in turn is dictated by the speed at which enters and leaves the brain. So it is not just by the presence of dopamine, the rate at which it increases dopamine, faster, slower. There are certain drugs that increase dopamine faster, like cocaine. There are certain drugs that increase the dopamine slower, like hallucinogens. All these points are from stall only. The rate of drug uptake is also subject to the route of administration of a drug. Route of administration, with IV and inhalational route being the fastest, followed by snotting. The rate of drug uptake is subject to Route of administration. Different drugs of use have different reward values, that is, the different rates at which they increase the dopamine based on their individual mechanism of action. These 4 points you have to write in the theory. First, the most important pathway is reward pathway. This you have to draw, and then you have to write that it is not just the increase of dopamine, but the rate at which it increases the dopamine. And the rate at which the drug enters and leaves the brain. Then the route of the drug uptake is route is also important, IV and inhalation being the fastest, followed by snorting. Different drug of use have different reward values. Vatsal Suchak, there is one another reward pathway by locus ceruleus, but that's not very acceptable, in the description. So we will focus on this only.